So one of the initiatives that that was started even kind of just as the resident arm of the Michigan Promise was forming was so that we could have designated personal time for an entire afternoon that we knew about well ahead of time to schedule doctor's appointments, dentist visits, random errands that we could only do during the day, or if we wanted to, that we could go home and nap for a solid 4 hours, whatever we decided. Because as you may find when you're a resident, one of the things that's very challenging is to be able to plan ahead for things that happen during the weekday. So sometimes, we'll get out early in the afternoon, or, our cases will be over, clinic will be done, things of the sort. But that's not something that we can really rely on and plan ahead for. So one of the things that we've already enacted this year is making sure that every resident has predictable weekday afternoon time that they know about, that they're required to not be in the hospital for, that they can use for their for any of their personal health related needs. The other thing is that from a global scale, we've really had a big push from the recent classes of chief residents to really value sending people home. I mean, pre-COVID, even if people aren't feeling well, sending them home, making sure to get people out of the hospital if you don't absolutely need to be there. Last year's chief residents had a big anti-lingering campaign. So if you were done with your work and you did not need to be there, they would look you in the face and say, go home, like, you don't need to be here. You're done. Go home and do whatever you need to do. So I think that that was incredibly helpful for sort of keeping people, physically and emotionally well. And Mike Kemp and I continue to work on additional programs to sort of formalize this, to make sure that we continue to be a program that makes sure that we're keeping our residents healthy and safe and fit. Does anybody else want to chime in? I know that Dr. Sandhu has done a lot to make sure that residents are at their best physically and mentally during the COVID pandemic, specifically since we were hit so hard. Do you want to talk a little bit about some of that activity?
Sure, Michaela. I'll start off by addressing another question that was in there, and that will dovetail nicely into the wellness piece. So there was a question about cultural competency. And I feel like my answer should be, oh, let me count the ways, right? There is so much that the Department of Surgery is doing with respect to fostering culture, but also with respect to developing, enhancing cultural competency. So the Culture Crew is an initiative that spans across the Department of Surgery. There are 6 components. There's a training team that really looks at training initiatives, everything from bystander training to anti-racism education, anti-bias education. And then there's a team that focuses on the HOPE initiative, and I'll leave that for Dr. Newman to share more about that initiative. There's missions and objectives, which really make sure that we are thinking about culture at every point. There's an assessment team, the Walls Do Talk, which we've already talked about tonight, cultural complications, which Dr. Dossett mentioned, and as well, there are the wellness initiatives, which I'll dig into a little bit. So through this, we really do create opportunities to continue to better understand culture, cultural competency, cultural humility across all of the different identity spectrums. Should also mention we have the Michigan Women's Surgical Collaborative, and so we look at culture with respect to gender diversity, sexual diversity. So thinking about culture from all of those different aspects of the prism is something that we've been working on and continue to work on. And getting to that point about wellness. So wellness during February and March was critical. It wasn't just me, there was a team of us. There were faculty members, there were residents, there were staff members who all banded together. Everything from creating a list of individuals, high school students who would be willing to babysit the children of faculty or residents who needed to go into the hospital. I mean, there was sort of lots of really grassroots initiatives, people willing to drop off groceries, people willing to, if they had a second home, opening up that second home to individuals. So taking care of each other was something that was very important to us. we continue to reach out using surveys and just individually texting every single faculty member, resident, touching base with them, seeing how they're doing, identifying resources to help them, or putting them in touch with the right person that could support them, whether that be a peer or a faculty member. So this is a team effort. All of us look out for each other.
Thanks.
Can I follow up one comment about that? I think in general, and Michaela can like tell me if this is not true, but I think we definitely listen to the residents, right? Like this is a very resident-led program in the sense that like, there are a couple of questions in here about like, do you listen to resident feedback? How do residents change the curriculum? What are how do you know when you need a new area in Michigan Promise? And like, my answer is listening, right? Right? Like my door is open and people come talk to me about things, and we do listening and learning sessions. Gurjit and we assigned, as soon as the pandemic hit, I was really worried about our residents because, as you all know, in particular, general surgery residents are like the Swiss Army knife of the hospital, and like they can do anything. And when when they're setting up ICUs in the hallways, the general surgeons are going to be the ones that are going to be running those beds, and that's kind of what happened. So we immediately kind of moved into like protecting them and kind of helping them, knowing that they were going to be called on to serve. So I remember, Ari Cantors, who is our chief resident, and Sarah Schubeck, who wasn't our administrative chief resident, but like might as well have been, like cornered me, and they're like, "Listen, we have a plan." And I was like, "You have a plan? That's great, because we need a plan." And so they laid out this whole plan. It basically involved the general surgery residents who served in the ICUs, served for a week, and then had a full week off to recover. And then they rotated back in for a week and then had a full week off to recover. And I think that was, you needed a full week off to recover after serving in a COVID ICU for a week. But like, I think I use that as an example of our residents are really self-organized and advocate well for what they need, and we empower them to do that. And I'm generally, as a leader, someone who believes that the people who are the ones on the front line know the best of what the solutions are, and my job is to empower them. And Sarah and Ari came to me knowing full well that I would back them if they had a solution that was workable and solved some of their problems. So I think we're very responsive to the residents. We listen to them, and a lot of these things, it's not like an accident that the residents have a Michigan Promise. It was like, as soon as we started rolling out, the residents were like, "What about the resident Michigan Promise?" And I'm like, "That's a great idea. Let's do that." And of course, then we created Gurjit's role to be a vice chair of resident professional development to run the resident Michigan Promise. So it's literally just responding to what we hear.